For cervical flexion, your setup will be seated. We want to make sure we're in a mid-range where our head is not all the way down and forward or all the way back and up. We're just sitting in this neutral spot. Now the motion that we're going to be attempting, that we will be resisting ourselves from actually performing, is this, with that head coming down and forward, mostly forward, a little bit down. Notice he's not chin all the way tucked. He's just flexing that cervical spine, but leaving the capital kind of skull part just along for the ride. So that's kind of following what his neck is doing. In order to resist this, he's going to clasp his fingers together and turn them around and place them on his forehead. Now he's going to attempt to move from this position to that very next position in that arc of motion. He's not trying to go all the way down to the bottom where he would end up having to tuck his chin. He's just trying to push his head mostly forward, but maybe a teeny bit down towards the ground at the same time as he resists that with his hands. And then he's going to relax. Common issues here is trying to go more down than you go forward and ending up with your chin down, as well as allowing yourself to move. So these hands have to prevent you from moving. He's going to show you a good, stationary isometric where he's just resisting into his fingers. He takes up the slack and kind of the tissue on the back of his fingers, and now he's stationary in this place. Muscles you should feel engaging live all up and down the front of the neck here. So you should feel those trying to pull your neck forward as your hands kind of resist you with those fingers on your forehead. So one more time, clasp fingers, top of the forehead, engaging these muscles on the front of his neck on both sides, trying to push forward into these hands as he's trying to take his neck forward, not just his head forward. He's trying to push this part forward in that direction.